Welcome to another episode of Med Madness. Today we will be discussing an important topic that significantly impacts maternal and neonatal health: short interpregnancy intervals. Understanding this condition is crucial for medical students and professionals alike, as it plays a vital role in the management and outcome of pregnancies. In this episode, we will explore the definition of short interpregnancy intervals, delve into the associated risks and complications, and discuss best practices for managing and preventing adverse outcomes. Next, let's discuss what this condition is. A short interpregnancy interval is defined as the period between the delivery of one child and the conception of the next, typically less than 6 to 18 months. This brief interval does not allow a mother's body sufficient time to recover from the physical and metabolic demands of pregnancy, delivery, and postpartum recovery. The most common causes include unplanned pregnancies and lack of access to effective contraception. The pathophysiology of this condition involves the depletion of essential nutrients like folate and iron during pregnancy, which are crucial for fetal development and maternal health. Postpartum blood loss and the continued nutritional demands of breastfeeding further exacerbate this depletion, leading to prolonged maternal anemia and increased risks for both mother and baby. Moving on to symptoms and clinical presentation. Women with short interpregnancy intervals often present with signs of maternal anemia, such as fatigue, pallor, and weakness. The risks extend beyond the mother, as these short intervals can lead to complications like preterm, pre-labor rupture of membranes, preterm delivery, and low birth weight in the newborn. Persistent genital tract inflammation from previous pregnancies may contribute to these outcomes, highlighting the need for careful monitoring and management. Next, let's talk about diagnosis. Diagnosing the complications associated with short interpregnancy intervals involves a thorough medical history and physical examination. Key diagnostic tools include complete blood count to assess anemia, ultrasound imaging to monitor fetal development and check for signs of PPROM or preterm labor, and nutritional assessments to evaluate maternal health. Screening for underlying conditions that could exacerbate the risks, such as chronic hypertension or diabetes, is also crucial. Next, we move on to management and treatment. Managing short interpregnancy intervals focuses on addressing maternal anemia and preventing pregnancy complications. Iron and folate supplementation are critical in replenishing depleted stores. Medical interventions may include the use of progestin-containing intrauterine devices or other forms of contraception to space pregnancies appropriately. Lifestyle modifications, such as improving diet and ensuring adequate rest, support overall maternal health. Preventive measures, including preconception counselling and education about the importance of spacing pregnancies, play a pivotal role in optimizing outcomes for future pregnancies. Let's consider a case study to illustrate these points. Consider the case of a 28-year-old woman who presented with fatigue and pallor just 6 months after delivering her first child. Despite breastfeeding, she became pregnant again, and her initial blood work revealed significant anemia. Her pregnancy was complicated by preterm labor at 34 weeks, and her baby was born with low birth weight. This case underscores the importance of postpartum care and effective contraception to allow for adequate recovery between pregnancies. With appropriate iron and folate supplementation and close monitoring, the mother and baby both recovered well, emphasizing the importance of early intervention and education. In summary, short interpregnancy intervals pose significant risks to both maternal and neonatal health, including maternal anemia, preterm labor, and low birth weight. Early diagnosis and effective management are crucial in mitigating these risks. As future healthcare providers, understanding these concepts and educating patients on the importance of spacing pregnancies can lead to better health outcomes. Don't forget to engage with the pre- and post-podcast quizzes and Anki flashcards to reinforce your learning and ensure you are well prepared for clinical practice. Thank you for listening to Med Madness, and stay tuned for our next episode.